Now we turn to Blake Griffin, his Rolling Stone interview, and discussing basically a big problem to me in sports and society. So here we go. Blake Griffin via Rolling Stone, when he was asked how do you feel about medical marijuana use in the NBA and with professional athletes, here's what he said. It doesn't really affect me, but so many guys would probably benefit from it and not take as many painkillers, which have worse long-term effects. So I would vote yes. I just think it makes sense. Now, Blake Griffin is a 4-time All-Star. Not only that, and it's a phenomenal Rolling Stone piece, so I highly recommend you read it. Link in the description below. I am going to write right now so I don't forget. Link in description. Put in, you idiot. Okay, I'm remembering for you guys. 4-time All-Star, and he's played in the NBA for 4 years. Seeing his stance, and maybe it's the LA mentality, many people will say, could be. But then we divulge into a larger, broader way of thinking and trying to dissect the fact that a lot of professional athletes that deal with nagging injuries are prescribed painkillers that could have a short-term and long-term effect on not just their mind, but their entire body. So Roger Goodell may okay medical marijuana use in his league if it helps with concussions and CTE. What about if it helps with like a torn ACL? What if it helps you with anxiety, stress, any of those factors? But I mean, okay, fine. If that's what Roger Goodell wants to do, hopefully we find something that will greatly benefit guys not taking painkillers for concussions. I mean, we know, and this is just going into another topic, but we know that a lot of the times concussions can have a long-term effect on your body. It can absolutely destroy your body, which results in sometimes suicide, a la Junior Seau and Dave Durison and many, many others, driving on the wrong side of the road, domestic violence, a few. So if medical marijuana use helps CTE, I understand what Roger Goodell is doing, but I just think there should be, it shouldn't just be limited to that one, though that is the biggest problem, obviously, in the NFL. Now, there's been a societal shift. Now, 2 states are fully legalized for recreational use. 17 states decriminalized. 20 states legalized medical use. Colorado, California, and Washington appear to be the pioneers, with Colorado and Washington being the 2 states that fully legalized for recreational use. According to a January 1st report via MSNBC.com, Colorado's crime rates are dropping ever since medical marijuana has been legalized. Interesting. So I want to get into the short-term and long-term effects, but I did ask one filmmaker who was making an incredible film about enforcers in the NHL. And it will be called Ice Guardians. His name is Adam Scorgi, a great friend of mine, humongous hockey fan. Don't give him too much shit in the comments. He supports the Oilers. He'll appreciate I said that. I wanted to ask him, and I did. We had a bit of a conversation today. I wanted to ask him, you know, and he interviewed tons of NHL players. He interviewed, you know, Crosby and Bobby Hall, and I believe he got Gretzky. And I mean, like phenomenal gets. But then when he was talking with the enforcers strictly, and even some of those who were off camera and side conversations he's had, and I'm not saying those are the guys that advocated for it, okay? I'm just plugging him and his work because he is a phenomenal filmmaker. Here is what he said when I asked him, how do some NHL players feel about medical marijuana use over painkillers? And he said, actually, there are several enforcers who want to get cannabis off the banned substance list because they find cannabis worked way better for their pain than the harmful prescribed drugs by the NHL doctors. And he says it's the next big step needed in pro sports. Athletes should have the choice in their pain medicine. And I asked him if I could quote him, and he said totally. And he said, basically, they find that cannabis works great for their concussion symptoms too. So you are hearing straight from the mouth of some NHL enforcers who will remain nameless, and they're advocating for it, and they say that it helps them with their pain. Yet we still are saying, doctors and the league even, are saying, no, we know what's best for you. Just take these and take this and take this. Take 2 of these a day and take this at night. And, you know, we make all these drugs. It's not, you know, it's not natural, but this will greatly help you. and then it'll potentially result in addiction. And he also went on to say, you know, that he's not surprised that Blake Griffin basically said what he said. Painkillers and addictiveness. We saw it with former Minnesota Wild enforcer Derek Boogaard, who unfortunately killed himself from doing too many painkillers that he was prescribed. An ESPN report via Outside the Lines found that retired NFL players misuse pain medications at a greater than 4 times that of the general population. They interviewed 644 former NFL players that were retired between 1979 and 2006, and they played an average of 7.6 years. The average age of the men they surveyed, 48 years old. 7% said they use more prescription pain meds than prescribed by their doctors. They use these without medication. They use the medication without a prescription at all, or both. The former players are 3 times as likely as men their age in the general population to be misusing prescription opioids. Right now, I think that's a lot. When asked about their prescription painkiller use while playing in the NFL, 52% of the retired players said they used prescription pain medication then, while 48% said they never used the drugs while playing. Of the players who said they used prescription painkillers while in the NFL, 71% admitted misusing the drugs. 15% admitted to misusing prescription pain medications within the past 30 days. The numbers don't lie. The studies don't lie. There is a problem with prescription pain medication. Now, some may argue, and I want to pull up another study here, some may argue that marijuana is addictive and that it should be illegal. And that's fine. They're entitled to their opinion. But if the statistics are here through studies via ESPN.com, among many other great outlets, and they are hinting that a lot of these people are misusing and deteriorating their bodies, when, not to sound stereotypical, but what will we do? Make you hungry, make you better at FIFA, and make you see things in a little bit of a different light. These short-term and long-term effects, this is again via drugfreeworld.org, of prescription pain medications. Short-term, loss of appetite, increased heart rate, blood pressure, body temperature, dilation of pupils, disturbed sleep patterns, nausea, bizarre, erratic, sometimes violent behavior, which, by the way, sounds like a guy who's used PEDs or suffered from concussions. Hallucinations, irritability, panic and psychosis, convulsions, seizures, and death from high doses, a la Derek Boogaard, RIP. Long-term effects. Permanent damage to blood vessels of heart and brain. High blood pressure leading to heart attacks, strokes, and death. Liver, kidney, and lung damage. Destruction of tissues if sniffed. Respiratory problems if smoked. Infectious diseases and abscesses if injected. Malnutrition. Weight loss. Disorientation. Apathy. Confused exhaustion. Strong psychological dependence. Psychosis. Depression. And damage to the brain, including strokes and possibly epilepsy. Blake Griffin is advocating for it. Larry Sanders is advocating for it in the NBA. Many other professional athletes are advocating for it. You have heard my stance on it. What is yours?